welcome back to the Radiant Anesthesia channel. My name is Dr. Jeremy Bates.
I'm Dr. Ryan Cooper. Welcome back.
We're back with our weekly topics. Remember to like and subscribe below if you're interested in these topics or just want to hear more from us. This week we come to you with what we consider a pretty hot topic, an exciting topic. Seen all over the internet right now and kind of all over in the medical world. It's GLP-1s.
That's right. And it's a newer topic too. It's something that we in the medical, particularly the anesthesia world, we're still in the process of figuring out what do we do with these types of medicines. So let's start by discussing what exactly they are. Do you mind explaining that to us, Jeremy?
Yeah, so GLP-1 stands for glucagon-like peptide 1. And specifically kind of what this medicine is doing is it's an agonist. It's basically ramping up that glucagon-like peptide receptor. And so really what we're doing here by taking these medications is we're impacting really three big mechanisms. The first one being insulin release. So this GLP-1 acts on the pancreas where insulin is released, and it's causing insulin to be released in essentially a more efficient and larger quantity so that the body that's already resistant, for instance in a diabetic, can now see more insulin from the pancreas.
Right. So from our understanding as well, these medications were manufactured with the intent to be diabetes medicines.
Correct.
And we kind of explained a little bit how they work in terms of controlling blood sugar in diabetics, which is obviously their issue. But it was noticed that these people were also losing a fairly significant amount of weight. And so what we have now is a second class of these medicines or a second usage of these medicines where people are using them for weight loss.
Right, and kind of more on that, the second mechanism that this drug impacts is gastric emptying. And what is gastric emptying? It just means the time it takes anything that you ingest, food, liquids, fats, and the time it takes for them to go from the stomach to the small intestine.
Yeah, layman's term, it takes longer for the food to get out of your stomach.
Right.
So,
and then the third mechanism that this drug is working on is especially the glucagon release. It's actually inhibiting glucagon release. So glucagon, in medical school, we always learn glucagon is, the glucose is gone, so you release glucagon, right? And so that's basically telling the body, eat, I'm hungry, I need basically glucose, sugar to function. And so this is also inhibiting that. So kind of stepping back a little bit, we want to take some time and talk about the different types of drugs that are on the market and both their brand name and trade name and kind of the interesting nomenclature that goes with that.
Yeah. So I think the one that comes to people's mind most commonly, particularly from the commercials and stuff that we see on TV, is a medicine called Ozempic, right? The generic name for that is semaglutide. We've all heard about that. We probably know people who are on that medicine. There is another medicine that's marketed called Wegovy, which is the exact same compound, same semaglutide. One of them is more for diabetes, and the second one, Wegovy, is more for weight loss.
Yep, and just like Ryan said, they're the identical medicine. They just have different indications. For a while, Ozempic was out there, and people noticed that weight loss taking place, and they wanted a piece of that weight loss. But if they weren't diabetic, they weren't technically allowed to be prescribed that. So essentially, the drug makers came up with another name for a different drug, but really the same drug, to perform that weight loss function without necessarily having to be a diabetic. Yeah. The other one that was kind of second in line and kind of even gained a little bit more traction was one called Mounjaro. So Mounjaro is tirzepatide, and tirzepatide was kind of released after semaglutide, had a little bit more specificity for the receptor, and just was a little bit more efficacious at doing what it needed to. Patients tolerated it better. That was considered the diabetes version, and then they came out with Zepbound, which is essentially the exact same drug, just now for weight loss. So, uh, there's several different kind of names for these things. Trulicity came out down the line as well. Same idea, GLP-1 focused drug, and they're more on the market and they're more in development right now. That drug makers are trying to get out to the market because it is such a popular drug.
Yeah. And to mention as well, all these drugs that we've talked about so far are administered by injection, self-injection. There is another drug called Rybelsus, which is also another formulation of semaglutide, which is taken in pill form. And as far as I know, that's the only one on the market for that right now. That's an oral medication.
Right, and I know there's several in development now, so you may see this down the road and say, oh well, actually there are more. Well, that's definitely a possibility because they are developing these so rapidly. Yeah. So now to kind of get to the bread and butter of what we're talking about today and why we're talking about it, we want to know and we want to talk about the reason why this is important for anesthesia.
Yeah. So the question is, why do we care about this? We're anesthesiologists. We put people to sleep for a living. And the reason is because of that second function that Jeremy had just mentioned, the delayed gastric emptying. That is something of utmost importance to us. And the reason being, if there's more food in your stomach for a longer period of time, when we put people to sleep under anesthesia, it increases the risk of something called aspiration.
Right, and you think about these drugs, a lot of them are being taken once a week, so it's not really something you just stop on a short time period. If you're in a car accident or trauma or anything else, all these type of things are really important when it comes to considering the patient coming in that is potentially on this drug and having it in your mind that this patient very well may have at least a partially or completely full stomach.
So, taking it all the way back, when you are scheduled for an elective procedure, most people are familiar with the term nothing after midnight. It's just kind of like an old adage, and the purpose of that is so that when you show up for your procedure the next morning, your stomach is empty. You haven't been eating, you haven't been drinking anything, because when you're put to sleep, everything sort of kind of relaxes. And so all of that tone that you had in your esophagus or in the sphincters between your stomach and your esophagus, everything just kind of relaxes. If you had something in your stomach, it increases the likelihood that it could kind of travel up your esophagus and then find its way into your lungs. And that's where the aspiration pneumonia comes into play. And so when somebody is on one of these medications, we can't be 100% sure that their stomach is quite as empty as it would have been without it. So that's why in the anesthesia world, we're a little bit paying attention to these drugs.
Right, and this is once again a clinician decision to focus on this. I know that at least in Ryan and I's world, we are focusing really on having a closed airway for the majority of our cases, meaning patients are intubated. When a patient is intubated, they have a breathing tube that goes into the trachea. There's a balloon at the end of it, and it keeps stuff out of the trachea that doesn't belong there. So for us, when we're thinking about this, after the tube is in, not so concerned. It's sealed off. But for those that are doing either you can see last week's episode on the different types of airways, but a supraglottic airway or an open airway, those people are definitely at higher risk for aspiration. Now, we try to mitigate all of this by putting a patient in a little bit of a head-up position to already give them that natural gravitational pull to keep things down the esophagus that don't belong in the mouth. And so, it's definitely still a clinician decision, but it's something that is at the forefront when it comes to this topic, the GLP-1s, because it does cause an increased risk.
Correct. Yeah. Fortunately, I haven't had any issues with this in my career so far, and I don't think Jeremy has either. We've had colleagues tell us that they put people to sleep. They swear up and down they haven't been eating or drinking anything all day, and they start vomiting, and there was food material in their stomach. I've even heard stories of people doing anesthesia for upper endoscopy procedures where basically you're putting a camera down the mouth into the stomach, usually to just investigate if they're having abdominal pain or any other reason, and observing food in there. They finish the procedure, wake the patient up, and the patient swears up and down, I have not been eating or drinking. they are on these medicines, and so it's just kind of a little bit of anecdotal evidence that perhaps these do actually slow gastric emptying, and it's a real thing.
Right. And I think it's something that we're going to continue to evaluate as an anesthesia society to determine what's safest for our patient, yet what allows patients to continue to live their life and have these procedures electively in a safe fashion. And so we're going to continue to do more episodes on this topic. This is something you can talk about for hours if you really get down to the nitty gritty of the mechanisms and how they function and really just all the different kind of downstream impacts in the healthcare field. There's now topics of how this is improving patients with cardiovascular disease, kidney issues, diabetes. So all the way down the line, there are applications for this drug. So as it becomes more popular, we definitely want to stay on top of kind of how this impacts us in the anesthesia world.
Absolutely.
And
thank you guys for listening to us again.
Yeah,
really appreciate it.
Thanks for listening to us. Make sure like and subscribe below. Yeah. We'll be back again in a week or two with another topic. If you have any ideas for topics, please comment below, and we will try to get the best content out for you.
Absolutely.